Today on Dueling Doctors, it's our man show. We're debating the best ways to treat ailments that affect the men in your life. Stinky feet, athlete's feet, snoring, and kidney stones. Why do these conditions affect so many men, and how can you help them fix the problem? Doctors from the world of conventional Western and holistic natural medicine have different treatment plans. And we even have an easy, foolproof way to get the stink out of smelly shoes. Dueling Doctors begins right now. It's holistic and natural versus conventional health experts with different opinions and one goal: to help you live a healthier life. Dueling Doctors. Hi everyone, I'm Dr. Frank Spinelli. Each week on Dueling Doctors, experts from holistic and conventional medicine debate the best ways to treat illnesses and conditions that affect many of us from time to time. Let's start by introducing our guest. Here to present a more holistic approach is licensed and board-certified acupuncturist and clinical herbalist from the Unova Center, Joe Blakeway. And with the more conventional slant, we have internist and my medical mentor and best friend, Dr. Larry Higgins. Welcome, both of you.
Thank
Very
you.
happy that you're both here. We're calling this our man show today because the ailments we're discussing seem to plague men more than women. Our first topic, stinky feet, athlete's foot. Athlete's foot is caused by an infection by the fungus trichophyton that develops in the moist areas between your toes and sometimes other parts of your foot. Symptoms include itching, stinging, and burning feet. Stinky feet are often the result of hygiene related to excess sweating and not allowing your feet to breathe. Athlete's foot, also called tinea pedis, is the most common type of fungal infection. So now we know what causes it. What's the best way to treat stinky feet and athlete's foot? Each of our doctors has up to 1 minute to present a treatment plan, and then the other will be given the opportunity to respond. We flipped a coin before the show to see who would go first, and Dr. Higgins, you won. So first of all, we were in hair and makeup and we were getting our pedicures. You all have beautiful feet. Nobody has stinky feet, but let's face it. Patient comes in, I find more often than not, they don't come in complaining of athlete's foot. It's something you often find on physical exam. Do you agree?
It depends upon the individual. If all of a sudden I notice seagulls are circling over the office from a certain
or
smell,
vultures,
then I picked up on the diagnosis. Anyway, just to the treatment for
so really, what does it look like? It's red.
It's red. It's irritated.
It's flaky.
The patient complains of itchiness.
Right.
The skin can flake. It can actually become quite excoriated and be prone to infection.
And excoriations, they mean like have cracks and fissures, and sometimes even boggy from the sweat.
Yes, yes.
Okay.
And the typical athlete's foot kind of scenario. The treatment, of course, is a topical borough solution, which is just aluminum acetate, just sort of what the usual, just what we'd use for underarms.
Right.
And soaking them will definitely, first of all, soothe the irritated
and
tissue, and also ameliorate the smell of, obviously.
So basically, you tell them, first of all, good hygiene, change your socks, wash your feet.
Change your shoe wear. Basically, the shoes that we wear are Club Med for funguses. They're warm, they're moist, and they're dark. So switching out...
what kind of Club Med you go to?
Well, that's another program. So shoes tend to keep the humidity
So
in.
the inlay in the shoe could actually help. You can buy those as well to absorb the moisture.
Open-toe shoes would be even an option.
I know.
Maybe
Remember
not in the winter.
when you were in training, didn't you wear clogs?
I did.
I wore clogs, which were these rubber shoes which had all the holes, and they not only support your arch, but they let your feet breathe. And now people wear, what, Crocs?
Yeah.
Sort of like
Same
the
idea.
same thing.
Yeah.
With
but
holes.
for the most part, we wear, except maybe...
Leather shoes.
We wear leather shoes that are very confining and they hold the sweat in.
And alternating shoes, not wearing the same shoe every day, will allow the shoe to dry out.
Okay.
As a matter of fact, as much as you can alter footwear would go a long way in preventing athlete's foot.
So you
and
do
stinky
all the
feet.
daily things. What could you do if it's just not going away and you need a treatment? They come in to see you for that.
Then the next step, besides a borough solution, is topical antifungals. For example,
like
Lamisil or ketoconazole would be even stronger.
Do you recommend lotion, spray, or powder?
Well, as a preventive, once the problem's been solved, then wearing an absorbent like cotton socks would go a long way. And number two, foot powder, good old baby powder would do the
talcum powder,
and that's going to keep the foot dry, keep it nice and smelling, and would go a long way in just preventing further things.
All right.
Yeah.
Jill? Help me with my smelly feet,
With
my
your
athlete's
smelly
foot.
foot and your well,
Yeah, you go to the gym,
yeah.
you see guys walking around all the time with bare feet, and I want to say, don't do that. Stop it.
Well, you're absolutely right. Patients actually don't come in and tell you they have athlete's foot.
Right.
You see it, and they don't think it's a problem. But in fact, it's a fungal infection. As you know, if you let it go on, it can get infected. So I think it's worth treating it quite aggressively.
Absolutely.
And I treat it from the inside and the outside.
Okay, so help me inside
I have
first.
to tell you,
Okay.
I was going to
Okay,
tell
yeah.
you, my old Chinese doctors used to say that the key to athlete's foot was to pee on your feet.
To pee on your feet.
I have never done this.
You've heard this?
I've rarely.
Rarely. I've never.
I know you wrote a book called Sex Again.
Yeah, no.
Is there a chapter on water sports like that?
I didn't
So that's
mention
something
it,
different.
and I never mention it to patients.
So, because the urine is actually has an antifungal.
Yes, apparently that works. If you're a woman, it's actually quite hard to pee on your feet, obviously, but men, I think, could probably.
So
pee
you
on
do
their
this
feet.
in the shower, I hope.
I would have thought so. I've actually never suggested it to a patient because if you're an acupuncturist, you're already weird. And then, if you
yeah.
say, "Why don't you pee on your feet?"
That'll just be the tipping point.
So here's what so here's what I do.
So urination on your feet
yes, but
for athlete's
my
foot.
old
Okay.
Chinese teachers who were very wise used to say that, and I bet it would work, but I've never tried it.
Okay.
Here's what I do: I make a wash with white vinegar, philodendron, and indigo for them to wash their feet, and then I give them antifungal herbs.
Okay, what kind of herbs would those be?
Something like astragalus is very
astragalus,
antifungal.
very good.
And then if you don't have someone like me to make you a wash, a special wash, you could use tea tree oil mixed with coconut oil. Coconut oil
And
is
so,
free.
do you ever recommend soaks? Because my father used to do Epsom salt. He wore construction boots. Every day he would come home, peel off the socks. You
Yes.
could see like the the
Yes.
smoke coming up from his feet, and he would soak them in Epsom salt. Do you have like a recommendation for a soak, or do you recommend Epsom salt?
Well, Epsom salt's great, actually, but for stinky feet, the old remedy is to put your feet in tea, because the tannin
tea.
actually
Any kind of
kills the
tea? Like
bacteria.
black tea or dark tea?
Yeah, black tea. The more tannins, the better, and it kills the bacteria. And the traditional remedy was half an hour with your feet in tea, 7 days. And but I think that's more for stinky feet than sort of antifungal. It's more for the bacteria of stinky feet.
So
you know what you can do with your stinky shoes, though? You can put them in a plastic bag and pop them in the freezer. That kills the bacteria, and then they don't.
So if you
smell
put
as
them
bad.
actually in the plastic bag, that was the tip I was going to tell you. But
You were going to
you
tell me.
actually put your shoes
Yes.
in a Ziploc bag,
Yes.
and you can put them in the freezer overnight,
Yes.
and that kills.
Yes.
You don't. I know you cook. You don't want to accidentally grab that
No,
and serve
no.
Dr.
dinner.
Larry's
but
a little skeptical
And
about
add it to a
that.
cassoulet. No.
No, it's a little scary.
It
Yeah.
doesn't go well with potatoes. I'll tell you right now.
And of course, probiotics. If you have
Probiotics.
athlete's foot, you should be taking a probiotic, or foods that are heavy in probiotics like yogurt and kefir and kombucha. and that
Would
kind
you
of thing.
also recommend hydrogen peroxide? Because I know that kills bacteria on your feet.
Yes.
That might be a nice way to wipe your feet. I know you don't want to put that on a cut, but
You could,
Just to kill
just even alcohol wipes at the end of the day
Really? Just alcohol wipes?
would be a good idea, I think.
do you have any soaks? Do you do Epsom salts? Do you recommend that?
Not really, because it's fungal, and the Epsom salt I think it might be soothing, but I don't think it would be going to the
It's good for
underlying
the smell,
problem.
I think the Epsom salts, but
More than
actually,
anything.
that's why I make the wash or the tea tree oil with coconut oil for the fungus. I think
So
you need
tea tree
something.
oil with coconut oil
Yeah.
and
On
apply it to
feet.
the feet.
Yeah, you just mix it up in a little jar and then put some on
Soaks,
at night.
definitely. You said with
Yeah.
black tea. Anything
Yeah.
else in soaks? Or
And a little wash with things like indigo and philodendron. I think that's good, and then some antifungal herbs and the
antifungal herbs,
probiotic.
astragalus and the probiotic.
That's
All right,
it.
I think we've covered that. We're going to take a break, and when we come back, the debate continues with the best ways to treat your man snoring. Find out how to finally get a peaceful night's sleep. Next. We're going to talk about stinky feet and exogenous.
More fun, aren't we?
Welcome back to Dueling Doctors, the show where experts from conventional and holistic medicine face off about the treatments of what ails us. We're joined by Western-trained physician Dr. Larry Higgins, and with the more holistic approach from the Inova Center, Jill Blakeway. Today we're talking about conditions that mainly affect the men in our lives, and it's time to tackle snoring. As many as half of all adult men snore. Snoring is the harsh sound that occurs when your breathing is partially obstructed in some way while you're sleeping. Air flows past relaxed tissues in your throat, causing the tissues to vibrate as you breathe, and this causes those irritating sounds. Each of our doctors now has up to 1 minute to present a treatment plan, and then we'll debate the pros and cons of each. Dr. Higgins, you were up first last time, so we're going to give you a little break. And let's start with you, Jill. Talk to me about snoring.
Snoring. Well, you know, actually, just a couple of weeks ago, I had a guy come into the office and he said, "My wife sent me because I
Yeah,
snore."
your wife.
Yeah, and it doesn't affect me; it just affects her, so she's paying for the treatment.
But it actually does affect him in some way.
It does affect
right.
him because, of course, people who snore at best suffer from fatigue, and at worst, if it's like sleep apnea or something like that,
because they're really not getting a good night's sleep because they're snoring and they're probably not in a deep sleep.
Exactly.
And they might be actually cutting off some oxygen at those times.
And then it's a strain on the heart. So it is actually a problem for him too, even though I know it was a problem for his wife and she was paying for the treatment. What I usually do is give people acupuncture because there is a study, there was a 2001 study published in Sleep Medicine that showed that acupuncture reduces inflammation and tones up the muscles in the throat in a way that actually reduces snoring.
And where do you do the acupuncture?
We do some around the throat.
Really?
Actually,
Okay.
yes, we do. Gently.
Gently,
I'm a very gentle acupuncturist.
You don't want to go too close to the trachea.
Yeah. And there
If you hear a hissing noise, stop.
It's interesting that I ask lots of questions too, because different types of snoring are a different problem. And people who snore with their mouth shut often have a tongue problem, and people who snore with their mouth open often have a throat problem. People who only snore on the back have a mild problem. People who snore when they're on the side have a much serious problem.
So what foods in particular are you worried about for phlegm production? Because that's what's interesting.
Well, I usually give the following diet advice. I say don't do alcohol at night because that relaxes your throat even more.
Yeah,
and, you know after you've had a drink. Even I
snore more
after I've had a drink,
absolutely.
and I do not snore much. So I believe. We should ask my husband. But
We'll
so
get a
I
video
believe.
cam on that.
And no phlegm-producing foods. Sugar, processed foods. Some people are very responsive to dairy and get phlegmy in response to dairy. Some people.
I always thought that was like a myth that dairy actually produces increased phlegm production.
Some people do, and some people
some
don't.
people do,
And so you kind of know if you are one of those people. Do you know what I mean? So it becomes a very general thing.
So
which is
the
probably
good
not
tip
true.
would be not to drink alcohol before bedtime.
Yes.
Don't smoke.
Yes.
Because that can really help,
Yes.
hinder your airway
Yes,
and cause
exactly.
obstruction. And probably lose weight. People with thicker necks are known to snore more.
And you know what's really helpful is one of those cervical pillows they make for people with neck ache. So that your neck isn't propped up. Because if you can keep your neck straight, which we do for people with neck pain all the time, we give them those pillows with a little sort of donut hole. Those actually really help snorers as well.
All right. Well, Dr. Higgins, what do you do? Because I know snoring has become one of those things where I guess somebody comes in with their spouse and says, take care of him because he snores like crazy.
It actually could be a huge problem when someone comes in with snoring, whether it's by their spouse or they figured it out themselves. Snoring is actually, it depends on what's causing the snoring, and each one is dealt with differently. If it's sleep apnea, that needs to be addressed because patients with sleep apnea have a 50% chance of having a heart attack. It's not like a minor kind of thing.
So with sleep apnea, there's actually a relaxation and the airway is being obstructed.
The glottis
either
sort
by
of falls back on itself.
tongue or the glottis is collapsing, and that causes a period. Apnea is a period of non-breathing.
No breathing, and they're
snoring, and then they wake up.
They can have periods of no breathing up to 90 seconds. Wow. And think about how many of us can hold our breath for 90 seconds.
Not me.
And so well, I can. The periods of apnea, meaning not breathing, can have a disastrous effect.
And the long-term effects can cause pulmonary hypertension, really cause
cardiovascular disease.
Cardiovascular disease.
At risk.
Right.
And the immediate treatment for that, they would have a sleep study, which would then prove it, and then CPAP, which is a continuous positive airway. It's this apparatus that keeps the airway open.
My father used to have to wear that, and you have to sleep with this at night, and it's pushing air into your lungs.
And it's very Darth Vader. The things that you'd really want to do is, which Jill had mentioned, you'd want to avoid alcohol before bedtime. Losing weight is one of the best things
really
you could possibly do.
Yeah.
But the other causes of snoring, just in terms of, it can just be a very large turbinates or adenoids or uvula, which is that little thing that hangs in the back of your throat. That's Latin for grape. They can go in with radio frequency and obliterate it. It's an outpatient procedure, and that in and of itself can get rid of the problem.
So really it's when sleeping on your back that's causing this problem because you're reclining.
If the person's lost weight, they don't drink alcohol before bedtime, there are other conservative measures, and one of them is you could just take a shirt that has a pocket, wear it backwards, and put tennis balls in the shirt, and it
Wait. Tennis balls?
Tennis balls.
They're not ping pong balls.
No,
because he showed me a ping pong trick many years ago. It's not
different.
This is a tennis ball. Okay, tennis.
Or a rack.
So you put the tennis ball on your back, and what's that prevent you from doing?
It prevents the person from sleeping on their back. They'll always on their side.
Because it's uncomfortable, so they'll sleep on their side,
keeps
which
their
will prevent
epiglottis open
the
and
apnea
prevent
episode,
the jaw
so they're
from
not
falling
smart.
backwards.
All right, well, that's interesting. I love the tennis ball trick.
I love it too.
We're going to have to take a break, and when we come back, treating and preventing our final male ailment, painful kidney stones. We'll be right back. Tennis ball. I was going to ask you, how do you get the tennis ball on your back? But that makes sense. You put it in the pocket, and we're like a cake.
But
Kidney stones, or nephrolithiasis, are small deposits that form inside your kidneys. The stones are made of minerals and acid salts. Kidney stones have many causes and can affect any part of your urinary tract, from your kidneys to your bladder. Often stones form when your urine becomes concentrated, allowing minerals to crystallize and stick together. Passing a kidney stone can be quite painful, but the stones usually cause no permanent damage. Now you know what they are. Each of our guests has up to 1 minute to present a treatment plan. Dr. Higgins, you're up. So how does a person with kidney stones present?
usually with flank pain.
So back here,
in their back,
flank.
fever, sometimes unbelievably nausea, and pain, as you mentioned earlier.
So you have to really differentiate back pain, just good old back pain, from a kidney stones. What else are you worried about, especially, you know, it could also be gallbladder, correct? If it's on the right side, maybe?
Could be, it could be. You know, obviously there's no substitute for a good physical exam, but when you figured out that the cause of their pain and nausea is a kidney stone, the first thing you have to do is deal with the pain. So you even morphine, pain medication, diclofenac, Voltaren, whatever, you've got to treat their pain. And you've got to treat their nausea. Their nausea is unbelievable, and then you need to get to flushing the stone out.
So
hydration, IV fluids.
Whether it's IV fluid or even just start drinking even before you see the doctor.
Well, going past after the kidney stone is diagnosed and treated, then just preventive, you really want your patient to drink at least 2 liters of water a day, and that will go a long way in preventing yet another episode, because it is extremely painful. It depends upon the size of the stone. If it's a tiny stone, like say smaller than 10 millimeters, then you can kind of get away with
flushing it out
and pain management. If it's greater than 10 millimeters, then you're possibly stuck in the stone's just not going to pass naturally with hydration, and you're going to need to probably go in with lithotripsy, which is just a very long word.
So the patient calls you up, I know I've had a kidney stone, I had one in the past. You say it's really bad because the fever, nausea, you send them to the emergency room. How would they go about diagnosing? Ultrasound?
Ultrasound or an IVP, an intravenous pyelogram, which is
they inject dye,
just
and
a
you
dye.
can see the urinary tract and you could see
and the
stone.
beauty of the IVP is that you can, number one, make the diagnosis, and in doing the IVP, it pushes the stone out.
Okay.
So you're sort of getting 2 for the price of 1.
Diagnostic and therapeutic.
At the same time.
So you mentioned treatments. If the stone does not pass, you could do lithotripsy, which is using shockwave sound waves
You
to
put the
actually, go ahead.
You put the patient in a big bath of water, and with little sound waves, pulverize the stone so it's tiny enough to be excreted. And if that doesn't work, then obviously the third line of treatment, which is a lot more aggressive, but you've got to do it, is surgery. Either you can go in
like a cystoscopy where they go in through the urethra, pull it out with a basket.
And then worst case scenario is that you have to do an open
surgery,
reduction, go in and remove the thing.
Which usually isn't the case.
No, very, very rare.
All right, Jill.
Kidney stones.
Kidney stones, there's nothing to laugh about it. I was joking, but it was very painful.
They really do hurt.
And you think you're going to die.
Well, you can do acupuncture to dilate the ureters a little bit.
So acupuncture in the area will actually dilate the ureters and hopefully
there's a
pass the
treatment with
stone.
electrostim, and I have done it for people. I actually know a little thing or two about kidney stones because I had some. That I didn't have to pass them, but on a routine sonogram, they found 3 little stones in my kidney, which I think is because at work I forget to drink. I don't know about you, but
so
I see a lot of patients, and
doctors are their worst patients.
We're the worst, aren't we? We tell everybody to drink water.
So water, really hydrating,
Yes.
especially if you've had a history of kidney stones, you want to make sure you're preventing future ones.
Yeah.
So what else would you look at?
I made mine go away because I did not want to pass mine, and so I made them go away. And what I did was I took a formula called Amber Stone Transforming pills.
Amber Stone Transforming pills. I love
There is a company here in the US make it. It's a traditional Chinese formula.
And it's a pill or a drink?
It's a pill.
Okay.
Well, you can take it in drink form, but the company in the US that make it are called Golden Flower, and they make it in pill form. I took those every day, and also magnesium, which
Magnesium
is
is very good because it relaxes the muscle.
Exactly.
Okay.
And I went back after 2 months, and my little stones had gone, and I hadn't had to pass them. And from then on, I took a little water bottle with me from patient to patient because I realized I'd created my own stones.
It's also very important to add that you should know what kind of stones, because they're made up of different things, where the calcium oxalate or gouty stones. So that's also helpful because you need to know what to modify in your diet. Low sodium, low oxalate, which could be in a lot of foods like soy, rhubarb,
spinach,
high in oxalate. Things that people think of as
things that are good for you, but you have to know what kind of stones you have to in order to prevent them.
And which we always
calcium as
we
well.
always tell patients, strain your urine if
So
you
that
can
we can
catch
tell.
the stone.
But only if they have stones, not just in general.
No, not just in general, unless they want to treat their feet and sort of.
And then you bottle it and pour
or
it on your
jellyfish
athlete's
sting
foot.
or at the same time. It depends.
Exactly. Well, you guys, we need to wrap things up, and I want to thank you both so much for coming to my best friend and to my new best friend. All right, we'll be right back. So good. Glad we got to the lithotripsy and the shockwave. I love the shockwave. Welcome back. The medical ailments that affect the men in our lives has been at the top of the chart today. Here are a few final thoughts. Men are known for their stinky feet, but there's something you can do about it. Make sure you wash your feet daily, keep them dry, and wear a clean pair of socks every day. My father used to soak his feet in Epsom salt because he wore construction boots which made his feet smell. For athlete's foot sufferers, I recommend the same tip, except you may need a topical antifungal cream to keep the fungus from spreading. Now, although snoring is annoying to your partner, it could mean a serious underlying medical issue for you related to sleep apnea, in which sufferers rarely get a good night's sleep because the oxygen supply is getting cut off. See your doctor to rule out sleep apnea. In the meantime, try to lose weight and avoid alcohol before bedtime. And finally, if you think you're having a kidney stone, drink plenty of water and take something for pain. If the kidney stone doesn't pass on its own, see a doctor. More than likely, you will pass the stone, but a thorough review of your diet is of the utmost importance in order to prevent another one from occurring. I'm Dr. Frank Spinelli. See you next time for more healthy discussion on Dueling Doctors as you explore the best path to your own personal prescription. And as always, please be sure to talk to your healthcare provider before making any medical decisions. We'll see you next time.